We are here today to discuss the latest on the COVID-19 virus and what Oklahoma is doing to minimize the risk for citizens in our state. Let me start by clearly stating that there are no confirmed cases of COVID-19 in Oklahoma. The infection risk in Oklahoma remains low at this time, and we are prepared and remain vigilant in our surveillance of this situation. With this being said, the state is taking this global epidemic seriously and its recent introduction into the U.S. The state is well positioned to monitor the developing situation, deploy assets as needed, and protect the public health and safety of Oklahomans. The Department of Health and its many partners have been working every day to protect, mitigate, and prepare if a case is confirmed. Just this morning, the Department of Health held an exercise with my entire cabinet, and we walked through every angle of Oklahoma's response in case and to make sure that we are prepared in every single area. Earlier this week, I was also joined other governors from across the U.S. on a call with Vice President Pence and senior health officials on the national response. And Oklahoma also was one of 30 states that was present at the White House last week to join federal, state, and local health officials in coordinating their response efforts. The degree of risk can change quickly, and in the event the situation worsens, Oklahoma has a statewide plan in place that is operational. I encourage you to seek the most current information from CDC and our state health department. The most important thing you can do is be vigilant in washing your hands, staying home from work or public gatherings if you are running a fever, and avoid close contact with sick individuals. Strong community partners between local health departments, the healthcare sector, faith-based organizations, schools, businesses, and other community partners are vital for this response and will be necessary to prepare for and coordinate if an outbreak occurs. While we remain vigilant and prepared, to date, we have had 11 deaths from COVID-19 nationwide and 18,000 deaths from the seasonal flu. So just to put everything in perspective, 18,000 deaths from the seasonal flu nationwide, and we've had 11 deaths from COVID-19. Here in Oklahoma, we've had 0 cases of COVID-19, or obviously zero deaths from COVID-19. 53 deaths from the seasonal flu in Oklahoma. When it comes to the response and preparation in Oklahoma, we have a great team at the Department of Health and across all of our other state agencies, and I'm confident in their ability to effectively inform the public and quickly work to respond to any cases if they may rise. I would now like to introduce our Commissioner of Health, Gary Cox, to provide additional details to my fellow Oklahomans. Commissioner.
Thank you, Governor. Our primary focus in public health is the health and safety of Oklahomans. And so we're taking actions as we speak and doing the necessary things that it takes to prepare should an outbreak occur in Oklahoma. To emphasize again what the governor just said, there are no positive cases of COVID-19 in Oklahoma at this time. And we're working with our partners in our network across the state of national, state, and local partners to be prepared and monitor travelers and the situation in general. It's important to remember that we've been here before. We've been through MERS, we've been through H1N1, we've been through West Nile virus, SARS, and other viruses, novel viruses that we've had to deal with in the past. The public health system has been on the front lines, and we have learned many lessons that will help us prepare for our current situation. A recent report for Trust for America's Health states that Oklahoma is a top-tier state in public health emergency preparedness. So we're testing individuals who are under investigation at this time through the CDC. The Public Health Laboratory at the State Health Department is currently have received test kits, and we are actually in the process of validating those test kits to make sure that they work as expected. It's anticipated that we will begin running samples in our State Health Department laboratory next week. We do have caches of medical and healthcare supplies that are stored in strategically located warehouses that can be provided upon request, and we do have the ability to make requests if needed. Just a bit of information about spring break. It's fast approaching, as you know, and if you are planning to travel, we encourage potential travelers to be aware of international travel destinations. Please be aware if you travel to countries that have a level 2, which would be Japan, or a level 3 travel notice, which would be China, Iran, South Korea, and Italy, you should be prepared to stay home for a period of 14 days from the time you left an area that has widespread or ongoing community spread. Also like to mention that the Oklahoma State Department of Health is in the process of establishing a call center dedicated to addressing questions from the public on COVID-19. And we strive to give information and empower our citizens through information and awareness. And we want to provide accurate information on COVID-19. And this information is updated daily. And so please visit Oklahoma State Department of Health website at coronavirus.health.ok.gov. I'd like to now introduce our state epidemiologist, Lawrence Burnson.
Good afternoon. So just want to give a few facts regarding coronavirus. So COVID-19 is a respiratory disease that's caused by a novel or new coronavirus that was first detected in Wuhan, China, and has now caused confirmed cases across more than 80 countries. While information so far suggests that most COVID-related illnesses have been mild, older individuals and individuals with underlying medical conditions, such as those that may affect your heart, your lungs, or immunosuppressive conditions, does place an individual at a greater risk of illness, so we have to keep our more vulnerable populations in mind. The virus is mainly spread directly from person to person through droplets, so nose and throat secretions, where an individual essentially produces those droplets when they cough or sneeze in close proximity to another person, like within 6 feet. Symptoms usually appear from 2 to 14 days after exposure from an individual that is infected with novel coronavirus, and those symptoms may include fever, cough, and shortness of breath. We have tested 5 Oklahomans to date, and at this time, none of those have been confirmed as having novel coronavirus. But it's a point to share that we are working with clinicians 24/7, 365 to assess the risk of individuals if they have specific symptoms and have a concerning exposure, such as recent travel history, so we can identify and detect the event we do have a confirmed case, but at this time we do not. So we are testing individuals who meet the criteria for persons under investigation, working with CDC at this time. Again, the best way that individuals can prevent infection is to avoid essentially being exposed to the virus. So we want to remind everybody to remember those everyday preventive measures that helps to reduce the spread of respiratory viruses, including avoiding close contact with other individuals that are experiencing symptoms of illness, frequently washing your hands with soap and water, or using alcohol-based hand gels if you do not have readily access to soap and water at the time. And avoiding touching your eyes, nose, or mouth when you have not recently washed your hands, because sometimes we pick up germs and then accidentally infect ourselves when we have direct contact with individuals caring for loved ones or picking up from surfaces and then accidentally touching our eyes, nose, or mouth. Practicing good respiratory hygiene as well. If you are the one that develops symptoms of illness, you want to exclude yourself from public spaces and really try to stay at home while you're taking care of yourself with fever, cough, and sore throats, so we can avoid spreading germs to others in the public. So that way you're protecting yourself, you're protecting your loved ones, and you're protecting other community members. And I would like to now give the podium back to Commissioner Cox. Thank you.
Thank you, Lawrence. The situation is evolving quickly, and now is the perfect time for businesses, for community, faith-based organizations, and other community partners to really that are vital to the response to prepare for and coordinate should we have an outbreak. All of us have a role to play in getting ready and staying healthy. And so now we'd like to open up for questions, and we have a number of experts here that are we'll try to field your questions as they are asked.
How many kids do you have testing kits?
Sure. So each state public health laboratory, including Oklahoma, received the first allotment of kits. Those are just a couple that are received each, but they can run several hundred tests per kit. And then those kits can be ordered through our partners through CDC as we need to increase our supply needs or as we need to continue testing individuals for novel coronavirus.
For somebody who suspects that they may have the disease, I mean, what do? You go to your doctor first, you contact the state, what do you do in that case?
Great question, thank you. So if an individual is concerned that they may have novel coronavirus, and again, you have to consider if you have symptoms such as fever, cough, and sore throat, and you have a concern of being exposed, such as recently returning from international travel where an area has widespread transmission, as Commissioner Cox mentioned, the specific countries that have been impacted especially, then what you want to do is, first of all, when you return, you want to avoid public contact and really essentially stay home for that 14 days so we can limit the risk of exposing others if you are to develop symptoms. So that's a precautionary measure to limit exposure to others. If you do develop symptoms, though, you want to contact in advance your healthcare provider that you would normally seek care and inform them in advance before showing up that you have symptoms of illness and you're concerned of exposure. That way they can make arrangements at the facility to receive you safely while minimizing potential risk of exposure to other patients and other staff so they can be prepared to receive you. That clinician will work directly with public health officials, so they will be contacting us immediately as well, so we can work with them, determine that the individual meets the criteria, and arrange for specimen collection and initiating our investigation so we can put in appropriate control measures to limit further exposure to other individuals.
For those people who don't have a primary care physician, they might just show up at the hospital, what do you respond to that?
Yeah, it's a good point. You're right. I mean, some individuals may not have readily access to a primary care physician, but if an individual decides to seek care because they're concerned about their symptoms, whether it be an urgent care facility, hospital emergency department, it's still important in advance, the place that you plan to go to, call that location first before just showing up. So that way, any facility is going to be prepared to receive the individual appropriately and safely, so we minimize exposure to other healthcare staff and other patients that are there seeking care for other conditions.
Coronavirus and the flu have very similar symptoms. There's also community spread going around in parts of the country. How are people to know the difference? I know a lot of people are just showing up, to get treated for the flu.
Sure. So influenza, it's a great point. Influenza, we're still experiencing widespread activity, and the flu season usually goes from October through April. And so if an individual has symptoms that, as you mentioned, can be similar, fever, cough, sore throat, body aches that last for several days, if an individual does not have a risk of exposure, such as they haven't had recent travel history or a known exposure to another confirmed case, then more than likely we're talking about another common respiratory virus like influenza. If an individual seeks care for their symptoms, there are tests that are available to detect influenza, rapid test kits through doctors' offices or additional laboratory testing through a laboratory. So there is a means for physicians to detect whether it's influenza or maybe some other circulating respiratory viruses. But if an individual has a concern about possible novel coronavirus risk, that's when it's certainly important to notify the clinician in advance, so that way the additional precautions can be taken and the consideration can be made for assessing novel coronavirus risk and then considering testing for that specific pathogen. But physicians may still conduct other tests to rule in or out other common respiratory viruses.
What does Oklahoma's statewide emergency plan look like? You said there's one in place.
Yeah, sure. Yeah, Scott.
Yeah, hi, Scott Sproat, Director of Emergency Response at the State Health Department. So we have a number of plans that are currently in place, including our basic emergency response plans, a pandemic influenza plan, the state's emergency operations plan that all work in conjunction and coordination with each other. The commissioner mentioned if we had to activate and request supplies from the Strategic National Stockpile, that's another plan we have in place with the federal government coordinated across the state. So multiple plans that we pull on based on the specific threat and kind of adopt those to the current situation we're dealing with. Mark?
Is there any kind of budget set aside for either public outreach, testing, things like that?
Well, we just using the public health funds that we currently have, and of course, as you know, the president has actually requested $2.5 billion There's bipartisan support for this federal appropriation, supplemental appropriation. There's some talk that it could be as high as $8 billion to $8.5 billion would be maybe a more likely number. I think the House actually voted on this yesterday overwhelmingly, and I believe later this week the Senate will take it up. And I think the indications are that it's most likely that the president will sign it. And so Oklahoma will be getting some help at the federal level for preparedness and for response. We've had 5 persons under investigation, 6, I'm sorry. We've had 6 negative tests by CDC, and we have 1 test for a person under investigation that's pending.
Have all been traveled abroad? Do they have that in there?
They've had travel exposure.
I'm sorry, is it one is pending right now?
I believe the one pending has.
Yes, sir.
I think
So
they all
5 negative,
have.
1 pending.
Yeah.
What is the status of that? I guess there would not have been a test here, so that's pending the CDC and everything.
We expect the results back any day.
Is that what we, I mean, that's not a presumptive positive test, right? That's the same as the other ones.
Right. Correct.
How is the state preparing for panic at the stores in terms of supplies and face masks and hand sanitizer?
We think by just what we're doing now, getting information out to the public, and we think really transparency is the best way to go, and getting out accurate information, and really getting out information that we are prepared and we're prepared to respond, and if you look at the situation, as the governor said, we have no cases in Oklahoma now, and so we have no deaths, no cases.
Well, there's none of those things that will be brought in somewhere else, or people are buying 20 gallons of milk or something like that, or even there's no face masks. Let's say that that's a scenario.
Well, I think for the general public, you're probably referring to an N95 mask. Those are really not. They're mostly for healthcare providers, and so those really have to be used properly. They have to be fit tested and all of that, and so they're really designed for and just a regular surgical mask is probably not going to be a good protection for a person to protect them from getting this virus.
Governor, what do your emergency powers look like? Do you have the ability to order quarantine, schools to shut down? What is your powers? Or do you need the legislature to
Well, and speaking back, just I talked to one of our state agencies that is in charge of procurement, and I told them to go ahead and order as many masks as they could get their hands on at this point, just to be overly prepared and overly cautious. So we did that. As far as the funding is concerned, like you said, we'll get some federal assistance if we need to. I can obviously declare an emergency. I'll work with Mark Gower, our emergency management director, if that was needed. California did that, and at that point, we obviously went through kind of a exercise with our cabinet, talking about what we would ask churches and schools and everything to do in case there was a widespread outbreak. But again, I want to caution everyone with the numbers. It's very important that Oklahomans know we're prepared and we have a plan. And if this does flare up and we see cases exponentially grow, or even one case in Oklahoma, we will start working towards making sure that the public is safe. But at this point, there's been no cases in Oklahoma, and I just like to remind people, about the common flu, influenza A and B, and it's 18,000 deaths in the U.S. alone this year. And I think, what's the total death count from this virus? 11 nationwide from this virus. So we've got to keep that in perspective, and that's kind of my message to Oklahomans is there's a lot of news media around it, and I just want Oklahomans to know that we're prepared.
Governor, you said you've been in contact with Washington. Just a comment that President Trump made last night on Fox News, talking about people that already have it doing the work, that kind of thing. He was confident it was a big deal. You said in your opening statement, do not go to work.
Exactly. Yes, I said, if you whether it's the flu or whether it's this virus, If you have symptoms and you've got a fever and a cough, let's not expose anyone. Let's not go to work, and especially in this heightened situation, we need to be more vigilant and quarantine ourselves and stay at home and not go to work or supermarkets and expose others.
Can I just clarify something? We've had 6 cases that have been under investigation. Have all those tests been sent to Atlanta, to the CDC, to be confirmed? Okay. And so, but now we're prepared in Oklahoma to do those tests here in Oklahoma City?
Yes, sir.
Now, if a doctor in Enid, say, encounters a patient and there's some concern there, what would the protocol be? Would they quarantine that patient immediately and send the sample as soon as possible to Oklahoma City? Or what would the process be?
Yeah, good one. So the first part is, of course, the assessment that the physician makes to understand if we're talking about novel coronavirus or another cause based on the individual's symptoms and history, such as travel history or known contact with a confirmed case, for example, in another state, another country specifically. Then they notify public health. We have a 24/7, 365 on-call system for clinicians to consult with us. If it meets the criteria where it looks like we need to at least consider novel coronavirus and we need to rule in or rule out, then we work with that physician to collect the appropriate specimens, get them immediately sent to our state public health laboratory at this time, and then get them shipped to CDC where then they're put in the queue for testing. So that's what's happened for the first 6 individuals, where we have 5 negative, 1 that's pending at this time in Atlanta. But that process will change quickly to where it will be our public health laboratory doing that testing, and we're working with a clinician. Then there's the investigation part, where we work with the clinician and work with the individual to isolate themselves until we know the result of that test and during the duration of their illness, so we minimize the risk of exposing others while we're even waiting for those test results.
How long will the test take?
So currently there is a several-day process with CDC, but when the public health laboratory has it in operation, essentially within a day we'll have a result, as long as the testing process works as expected, of course. And that will give us that initial presumptive positive test we know to assure that we need to move forward with the investigation, or if we have a negative, then we can rule it out. If there is additional retesting needed, then we will work with CDC to continue that. But that initial presumptive positive will certainly be used to put in action points of, again, isolating the individual, starting to monitor exposed contacts, and limiting movement of those exposed contacts so we can try to minimize further spread in communities.
Well, we already have the equipment. We have 3 machines, actually, that have the capability to run these tests. And so we have the capability to, depending on the demand, we can run up to 3 shifts per day. During the H1N1 outbreak, they were able to do a process about 100 tests per day. But if you were running that 24 hours, then potential could be around 300.
You have all the equipment now, why don't you have the lab up and running now?
We have the test kits that we've gotten. They have to be run through to make sure that they're accurate. And so there's a process, a very strict process, laboratory process that they have to go through to verify that those tests will yield accurate results. And that takes a few days.
Can you compare the death rate to the common flu compared to death rate so far for COVID-19? I've heard it's 0.01 for the common flu and somewhere over 2% for COVID-19 so far, which is getting up close to the Spanish flu of 1918. Is that correct?
Well, yes. I mean, the COVID-19 so far is the fatality rate is quite a bit higher than the flu. It's less than 0.5% for the flu. And depending on the figures that you see, it could be 2.5 to 3.5%. But it's anticipated that as more tests come in, then that percentage might go down, because many of the cases were probably light cases. And by the way, 80 to 85% of all the COVID cases are mild. It'd be like a flu or a cold. And so we do expect those numbers to come down, but this is a new virus. It's only been around since December, so things are changing quickly, and we're just getting information in.
Is the profile of this new disease similar to the Spanish flu? Spanish flu kind of went away in the summer of 1918, and then it came back in the fall when it got cold again, and that's where a lot of the deaths were.
Right.
Do we suspect that maybe this will have that same profile?
This is a novel virus. It's a new virus, and we just don't know. We don't know how it's gonna behave this summer and this fall. Hopefully not, but we'll monitor it very closely.
Just make sure it's 5 negative tests and 1 pending, right? Not 6 negative and 1 pending?
5 negative and 1 pending. Yes.
Thank you all.
Good job.
Great job.
Thank you.